lunch hour with us on this School of Medicine address. I'm Jeff Bumpous. I'm the new Executive Vice President for Health Affairs and Dean at the School of Medicine at the University of Louisville. And it's with great excitement that I address you in this new role today. Having served as the capacity as interim dean for a full year before the permanent appointment in July, I'm prepared to hit the ground running and continue aspirations for greatness in our teaching, patient care, research, community engagement, and other parts of our mission, always emphasizing inclusive excellence. Today, I'd like to spend a little bit of time reflecting on some points of pride, providing some updates on key initiatives, and outlining the core direction of our new strategic plan. At the end of the address, I will respond to questions submitted in advance and take questions from the chat if time permits. So let's get started. So the pride points that I'd like to emphasize, as some of you, or if not many of you, are aware of, is that 2023 and 2024 have really been banner years. As you can see from the list presented here, our faculty and staff have contributed greatly to us reaching new heights for our school and our university. A few of our many pride points include the award of $280 million from the legislature of the state of Kentucky in this last biennial budget. And this will allow for the building of a collaboration hub and simulation center that will bolster learning, research, and community engagement. This will be one of the first new buildings built on the HSC in 15 years. We also were awarded an $11.5 million CTRD grant as part of the NIH Idea State funding mechanism. And through this Idea State program for the School of Medicine, in conjunction with the university and U of L Health. This will expand our infrastructure for our community-engaged clinical and translational research, enhancing our ability to create and disseminate knowledge and to bring the bench to the bedside for our patient community. A new aging innovation venture studio supported by the generosity of the Traeger family, the aging innovation ecosystem by conducting structured programs to uncover challenges, build solutions, and launch new ventures that solve real problems. So we're very excited to bring this in conjunction with the Traeger Institute. Additionally, we were awarded a $16 million HRSA grant for urban and rural undergraduate medical education with a focus on addressing the primary care physician shortage in our state, in particular in areas that have the greatest health inequities. Renewal of the NIH Kentucky NBRE funding, with U of L being a major partner in that venture, funding for $25 million with an emphasis on leveraging bioinformatics and environmental health to help Kentucky population by incentivizing and training young investigators and young scientists from throughout the Commonwealth of Kentucky and enhancing our partnerships with our regional universities. Our faculty and staff shout-outs in these developments include Dr. John Klein, who now serves as our interim Executive Vice President for Research Initiatives and Innovation. Dr. Chris States, our interim Vice Dean for Research, Dr. Craig McLean, Dr. Aruni Bhatnagar, Dr. Bob Mitchell, Dr. Martha Bickford, and many others who I haven't named for their personal contributions that have helped make our medical school and HSC more successful in our research ventures. I'd like to talk about some 2024 initiative updates. Our progress is not slowing. As we enter the new academic year, there are many initiatives in progress that will continue to elevate our standing as a top-ranked medical school. Some of these include the following. We are continuing to explore developments with Murray State University with regards to a potential regional campus in West Kentucky. We are working with Ponce University, a medical school in Puerto Rico, in conjunction with our healthcare partner, Norton's, for pediatric experiential rotations for select medical students from Ponce University. As they've been affected by terrible tragedies and hurricanes on the island, they do not have enough clinical sites for experiential learning, and this can be an effective partnership and way for us to help our partners in Puerto Rico. Additionally, the FTI strategic alignment initiatives are well underway, and we now have strategic service line boards that are working in an earnest way across cancer, neurosciences, behavioral health, and cardiovascular health. Our funds flow redesign program have allowed us to have meaningful and formulaic understanding of how our funds are delivered to the various departments and across our mission. And this has been a Herculean effort that has involved not only the Dean's office, but the chairs and the Faculty Affairs office and many others. Additionally, as the HSC, we've worked with the legislator to participate in the HB 200 program, especially for our School of Nursing, to enhance the number of nursing scholarships and the potential number of nurses that can be trained for the Commonwealth, which has a great need for nursing providers. Additionally, we have expanded partnerships with our regional HBCU, our historical Black colleges and universities. In particular, reaching out with new programming and initiatives with Kentucky State University, with Meharry Medical School in Nashville, with our First Look program to encourage their students to think about the University of Louisville graduate medical education, fellowships, and residencies. Additionally, working with developments with Simmons College and others in the region. We additionally anticipate some work with Morehouse University later this fall to develop interactions and programs with these regional universities to encourage their students to consider U of L for both graduate programs and medical and other health sciences programs, particularly advanced programs that are not available at those universities. Additionally, we have established an AI task force through Dr. Sohail Contractor that works with not only U of L Health System, but with the School of Medicine to address the many emerging needs and many emerging opportunities regarding artificial intelligence and advanced computing in the healthcare domain. I'd like to give, again, faculty and staff shout outs for these initiatives. They've included Vice Dean Ann Shaw, our undergraduate medical education and student affairs dean, Dr. Kelly Bullard Dunn, our Vice Dean for community engagement, Dr. N. Kim, who's worked with our Bluegrass Biodesign studio and venture, working across many aspects of medical school. Glenn Giddings, our Chief of Staff, Kim Boland, Dr. Boland, the Chief of Pediatrics, and one of our principal leaders in our affiliation with Norton Children's Hospital. Dr. Jason Smith, the Chief Medical Officer for U of L Healthcare, Dr. Jason Chesney, our Cancer Center Director, Dr. Dwayne Compton, who helps lead our Inclusive Excellence initiatives, Dr. Faye Jones, who additionally has established and is running our distinction track in health disparities and in health equity, and Dr. Sohail Contractor, who I mentioned earlier, who's helped us with our artificial intelligence platforms, policies, and initial committee work and developments. Thank you to all of these many helpful members of our team. Let's talk a little bit now about strategic priorities. And I'd like to really think about, over the past several months, we've been working to finalize our 3-year strategic plan, or the second part of our 6-year strategic plan. Many of you took the time to review the draft and provide feedback, and we thank you for doing that. During the next few slides, I'll share some of the core direction for each of the strategic pillars of learn, discover, connect, and work. When we think about learn, let's think about how we are going to create alignment to showcase how our distinctive education prepares future physicians and scientists to advance the human condition. We're aligning admission strategy priority with the School of Medicine overall mission, more closely connecting the learning continuum across UME, GME, and interprofessional education and continuing medical education to create linkages identified across the learning continuum. In particular, in that ecosystem of learning, we want to have best class education around patient quality and safety. This is going to be an area that's important for healthcare across the nation and planet, and it's certainly an area that we want to distinguish ourselves with and be prime leaders in. Additionally, we want to develop advanced learning tracks that provide distinct career pathways. So we're planning on expanding on the current pediatric learning tracks for all residencies. And for example, one way we can do that is to be inclusive and scale up our business in medicine and bluegrass biodesign programs to include our graduate medical education population and our graduate school populations. So this is an opportunity for us to take already successful programs and to scale them up to really include even more learners in our ecosystem. Additionally, we want to establish the Health Administration's Leadership in Medicine Fellowship, also known as the HOUND Fellowship. This is principally operated out of emergency medicine, but is available for any GME trained resident who's completed a GME residency. This fellowship helps develop health administration leadership, again, an area that we want to move forward with and distinguish ourselves in. We thirdly want to enhance academic success and support services for all learners. It is really important for us to do two things: improve our learning communities with enhanced learning support, and we've already hired additional learning specialists to help with this, but we're by no means finished with the ability to do that. Enhancing programs that help preparedness for step one is one example in that regard. Additionally, with an all-university approach in conjunction with the student affairs team and the wellness team of the Belknap campus, we're going to enhance a comprehensive wellness program for our learners, from the graduate school to undergraduate students that rotate on this campus, to residents, medical students, and fellows. We want to make certain that we are taking care of the people who are most important to us. Fourth, we want to enrich the learning experiences and empower our constituents to be at the forefront of technology advancement through generative AI. One of the first steps of doing that is we are deeply investing in high-speed research computing and the clinical adoption of AI in documentation and utilization of AI to improve quality, safety, and efficiency in medical practice. Additionally, in conjunction with the health system, we will allow this to make the provider life more humane and allow our people to get home and have family time and independent time. So we should use AI as a tool not only to advance our ability to create and disseminate knowledge, but also to improve our wellness and quality of life of our faculty, staff, and our students. Number 5, we would like to offer opportunities for leadership development for all learners. We take a point in pride of having our health sciences leadership team and our HPE education office really doing cutting edge things across the continuum of our faculty and learners on this campus. We want to develop further opportunities through the continuum of our UME, GME, to our faculty affairs office. And in doing that, we're going to reach out to populations that we haven't been able to address by scaling up our educational offerings. We want to prepare learners and educators and the faculty for the healthcare system complexities of the next generation. We want to improve patient experience training. We want to develop training in teaming and health science systems that is focused on healthcare systems and quality improvement. Certainly, the building of the new collaboration hub building with a state-of-the-art simulation center will help us with this exercise in building stronger and better teams in healthcare. And lastly, in this area of learn, we want to prepare learners and investigators for the complexities of the research environment. We understand that teams are not only important in the optimal delivery of healthcare, but they are really critical for the optimal conduct of science and the delivery of science. So understanding and enhancing our abilities to do team science across the schools on the HSC and university at large, partnering across schools in a transdisciplinary manner and in the most meaningful ways possible. Next, I'd like to reflect on some areas of discover, which really are our research and innovation pillar. We want to build and enhance institutional infrastructure to support U of L research, scholarship, and creative activities. We're going to strengthen and integrate bioinformatics and biostatistics scores to promote research synergies. And this is across our departments and institutes, and also largely in conjunction with the School of Public Health and Information Science. Much of this integration and collaboration is already going on, and it will only become stronger over the future years. We want to develop a 21st century approach to grant submission and submission management. And thanks to Dr. Chris States, we are already making considerable strides in establishing this area, particularly in post-award management, which we viewed as an area of weakness that was an opportunity for us to strengthen our ability to conduct research. We're going to invest in the recruitment and development and retention of top researchers, faculty, staff, postdocs, and graduate students. We want to foster junior investigators through strengthening our now CTRD program for the Kentucky Center for Clinical and Translational Research. We want to keep the Kentucky NBRE program strong as a pathway program to lead excellent students into careers in science in the biomedical area. And we want to keep our COBRA grants and programs strong, so we are helping assistant professors and junior faculty create and disseminate new knowledge and also strengthen their own research portfolio and our labs by enhancing our ability to apply and successfully deploy meaningful federal funding for our research programs. We want to strengthen our neurosciences infrastructure with cluster hires, and that is already underway, looking across many departments, not only of the medical school, but the university. We have to expand research in cardiometabolic and environmental health research with the impact on cardiovascular disease. It's not only good enough to treat disease now, but we know that prevention of disease is an extraordinary important part of our portfolio that we want to build upon and that we want to be able to prevent the devastating cardiovascular disease that occurs in Kentucky and in this region. We want to build strength also in behavioral health in a transdisciplinary manner. In conjunction with U of L Healthcare and many other partners, we've established a behavioral health board, and that's going to help us enhance both our research, training, and clinical delivery portfolio for behavioral health that will have impact on this entire state and region many years to come. We want to expand also innovation and translational research, support including clinical research and clinical trials. So this will include things such as enhancing the clinical trials unit, the CTRD grant that we've talked about, improving support services for grant applications, including grant writing and editing. We're going to identify local and regional economic development opportunities also from the U of L School of Medicine, basic, translational, and clinical research programs. We are increasing grant funding related to cancer research through efforts of the Brown Cancer Center and the building of the Brown Cancer Center for Rural Cancer Research and Education in Bullitt County at Hospital South, and increasing our number and focus of funded investigators around cancer control to work towards NCI designation. Furthermore, and more excitingly, we're going to work on the MST grant for the MD PhD program. We've grown from 2 and aspire to have 6 new MD PhD students starting per year. And by participating again in this NIH Idea State program through the MST grant program, we will strengthen our ability to develop clinician scientists for a region that desperately needs it. Next, let's begin to focus on our community engagement pillar, or what we call Connect. We want to recognize and celebrate the works that empower our community. We want to raise the visibility of the work we do in the community through good storytelling and telling the great stories that occur in this health science center every day. We want to optimize our website architecture and programming and deployment so that it's facile, real, meaningful, interactive, and it serves all of our constituencies in the best way possible. We're going to engineer our future economy by developing creative ideas and technologies that facilitate engagement with industry, corporations, and community. We want to additionally advance health and health equity. We know that health disparities plague this region and plague this Commonwealth. We want to increase partnership alignment with health systems. We want to expand and prepare a diverse healthcare workforce because we know that that improves the quality of outcomes in healthcare. And we want to do community engaged research with experiential learning and clinical care that really encourage people to join communities that are have the greatest need. We want to create opportunities that bring people to campus and that also bring campus to people to improve the health of the community. So with the collaboration hub and intentional design, the facility enhancements will allow us to increase and enhance learner, faculty, staff, and community engagement in both our teaching and learning opportunities, our research, and in many other ways that we may not have even imagined at this point. We additionally want to improve our IT framework for tracking communications and engagements. This should be something that we could do easily and that we could leverage and that we could show our impact with in a better and more comprehensive manner. And this represents an important part of our storytelling as well. We want to recognize the broad impact of each of you and what you do for our school and university. Next, let's begin to focus on work. And this is internally focusing on who we are and the people, not the bricks and mortar, but the people that make us the School of Medicine and the Health Science Center. We plan to continue to implement and incentivize programs to cultivate effective leaders. We want to create onboarding and supervisor training that is more robust, meaningful, and specific. We want to collaborate with the Employee Success Center to customize onboarding for the faculty. We furthermore are already working to improve department and chair and division and decanal staff training on leadership and onboarding. So we have to do leadership and staff development that occurs not only from the entry-level employees, but also to our leadership and supervisor level employees, such that we are being a great ecosystem, a great place to work, and a place where people understand how we really care about each other and we really want to help each other, and that we have all of our oars in the water in the same direction. We additionally want to prioritize faculty and staff recruitment, retention, and engagement. We need to have more education on intentional laddering systems for staff advancement as a follow-up to the staff compensation study. And with a new vice president, a permanent vice president for human resources, I think we're going to be well on the way to be able to engage in that activity. Furthermore, we want to develop and communicate smart staff opportunities. This Smart Staff has been an exceptional program. It's grown and it's meaningful, and we need to keep that vibrant and moving. And I'm a firm supporter of the work that has been going on in Smart Staff. And I would give again a shout out to Dr. Glenn Giddings, Chief of Staff in my office, who I really think has been an architect and certainly a strong advocate and proponent in further developing this program for this campus. We additionally want to implement a comprehensive wellness program for support of faculty and staff. We talked about that with regards to learning, that if we're going to have student success, we have to have staff and faculty success. And we want to do that in accordance with the university strategies. So we are working with this one university approach, and we hope to have many more things to come with enhanced opportunities for wellness and enhanced activities that allow this to be the best place to work ever. In closing, I'd like to tell you thank you, thank you, thank you. It is the people that make this the School of Medicine and the Health Science Campus and the University of Louisville, and that make it a great place with immense impact. I think we're going to continue to create impact. I'm confident that we will, and we will grow on what we've done in the past century. That's not an easy feat, but we're going to adapt. We will prioritize, grow, and be stronger than ever. And although the plans we have for the School of Medicine and HSC are ambitious, I have no doubt that we will achieve even greater heights than the years past. And it's because of you, the people who tirelessly serve our purpose and our mission. Each of you are instrumental to our work to inspire future and current physicians, scientists, and leaders. And I thank you for your continued dedication and determination. As a powerful, innovative School of Medicine, deeply rooted as a Carnegie R1 community engaged university, we are solidifying our mission of improving the status of healthcare for our community, our commonwealth, our nation, and our world. Additionally, I would like to thank so many of you who have sent me congratulatory notes and have sent me many emails and messages expressing your confidence in me going forward as your leader on the health science campus as EVPHA and as Dean of the School of Medicine. I do not take this lightly. I serve you, and I serve this school, which I've served for 30 years. I have great pride in the University of Louisville School of Medicine, which I am an alumnus of the class of 1988. We recently celebrated Alumni Weekend, and we had a record number of alumni there. And we're continuing to enhance our engagement with our alumni. And more than 40,000 people who we actively email with and who actually open our emails and respond to us. So we really want to grow our relationship with our alumni community and enhance that. And we thank the many people of our Alumni Association who are taking leadership roles from fundraising and advancement to interacting in the classroom and teaching our students and having many, many more robust engagements across our entire Commonwealth and nation. Thank you. Thank you. I will now begin taking any questions that were submitted from the audience.
And if it gets a little quiet, I have a few questions that were submitted in advance, and I can prompt you with those. So it's your call.
Glenn, thank you.
In fact, I could start one off with you if you'd like.
Okay, that's great.
More of a broad one. How do you see your role evolving over the next 5 years to meet the changing needs of the institution?
Well, I think that's a great question. And I think the inherent in that question is that we all have to evolve. You know, the rate of change in society and certainly in medicine is higher than ever. It's accelerating. So I think we have to be facile, but I don't think we lose our roots there. You know, this community engagement, our teaching mission, our research mission, and making our workplace an optimal workplace are always going to be priorities and pillars for us. But in that, we need to adapt to new knowledge, new opportunities, and new challenges. So I think we look at the ecosystem, we scan it, and that also I know that this job makes me rely on many people. And I'm very grateful to have an exceptional staff of very talented people. So I want to grow our talent, I want to grow our capability, and I want to make us very facile and adaptable. I think that those are critical characteristics that are necessary for a modern academic medicine.
All right, I don't see any new questions asked just yet, so I'll just keep going to some of these. One around maybe an update on funds flow, specifically how we can make sure communicate on connectivity between resources between school of medicine and the health system.
Yeah, I think that's great. And, you know, I think now we do have a model that fundamentally shows us how we fund research and teaching. We also have to fund our clinical mission. The point of that is keeping a balance across that portfolio. So knowing how much it costs us to really pay for our teaching, what the sources are for that, what it costs to do our research, not only the research funding we obtain, but the investment that we have to internally make in research to keep it viable and to keep it growing and adaptive. So those are very important principles. We understand that better now than we ever have. We additionally are very grateful to have really two great principal partners, the largest of which is the University of Louisville Healthcare with our adult enterprise, and we have increasing integration there with an academic committee that is at the board level of U of L Healthcare, as well as a quality and safety committee that's highly integrated with the medical school, and with great representation on the board from the medical school and the university. So I think with those integrations, this will remain strong and we'll be able to make sure that we keep the clinical mission fueled, the teaching mission fueled, as well as the research mission. And that's something that we're able to take a very close look at now and that we have better statistics and dashboards on. So I think we'll increasingly be able to do that better in this strategic
plan. Hey, can we stick on that and then I'll get to the first question asked, and specifically, what are key performance indicators that'll help you measure success in this tripartite mission, and making sure that there's accountability for achieving the goals for both institution and hospital?
Well, there are many, and I think when you think of metrics, you think of lead metrics and lag metrics. So you really want early indicators that you're on point and that you're doing the right thing. And then there are lag metrics. For example, if I looked at education, I would say our graduation rate within 4 years for the School of Medicine. Some would say even 6 years. That's additional metrics. So those are lag metrics. Those are things that you wait till the end to measure. So we want to make sure that we know our students are doing well and are well prepared for step one and step two, that they're navigating the system well, that they have the support mechanisms they need to build success. So that's an example, I would say, in teaching metric. In clinical care, we want to make sure that we're meeting the service needs of our clinical providers, but not sacrificing our teaching needs. So we have to bring the teaching programs, particularly in clinical medicine, along and in alignment with the clinical mission of seeing patients. And that's always a challenge. It's a dynamic, but we have to maintain that. We can't sacrifice one for the other. And we are a school, so we must be able to educate and teach across that. So I think while we want to see a healthy bottom line for the health system, we want to see advanced therapeutics being really a capability that we have and that we can accentuate. We also want to make sure that we're having primary care clinics and clinics in neighborhoods that have health disparities, because we want to grow workforce there, and we want to also expose our students to the problems that occur in those various communities and to know what it's like to practice in communities that have health disparities. So it's a balancing act with using a number of metrics across teaching, a number of metrics across clinical care and finance, and a number of metrics across research. Research, of course, has many. Again, you can look at the amount of Blue Ridge rankings and the amount of NIH funding, but really those are, again, lag metrics. We have to look at other metrics like how many new grants do we have? How many new assistant professors do we have that are obtaining R&K awards from the National Institute of Health? How many transdisciplinary programs are we growing? How many papers are we producing in excellent journals? And how much impact are we having on our community? How many new businesses and new types of healthcare enterprises are developing because of the work that we're doing in our health science system? So those are some examples of things that we need to follow and follow more robustly. Each of these strategic pillars in clinical care will have metrics that they are following, and the Quality and Safety Committee of U of L Healthcare will have extensive quality and safety as well as reputational metrics that they're following that allow us to really keep ourselves on point and to get better and better each year, not for the sake of just achieving better rankings, but the people who achieve the best rankings are doing good things. So we want to be people who are doing good things and having great impact.
Gotcha. I will get to some of the questions being asked live. So can you please expand upon what your vision is for the potential Murray State collaboration?
Well, I think there are several. And I mean, one thing that we know is that areas of 107 of 120 counties in the Commonwealth of Kentucky are health profession shortage areas, according to Health and Human Services. Many of those areas are in our rural communities. Appalachia and West Kentucky is one in particular. So the Jackson Purchase area and the adjacent Penny Ryle areas of the state. In these areas of the state, there are very few physicians. In fact, 5 counties that are in West Kentucky along the Ohio River have no physicians at all. And we've learned from our experience in our medical campus in Madisonville that if we can train physicians in a rural environment, the opportunity and the likelihood for them to remain in a rural community or a rural adjacent community to provide care is exponentially increased. Murray State University is a strong regional university. They have strong STEM and science programs, and we are in preliminary discussions of working with them for a regional campus. We're looking at various models that might apply. We have a lot of work to do. We're in the infancy of this project, and we have a lot of work to do. But the encouraging thing is that we do have a lot of steam and a lot of initiative that is coming from both universities, and certainly a lot of initiative from the West Kentucky community to help improve their posture in healthcare. And this is a place where we can make impact in the Commonwealth. We have many relationships in West Kentucky. We do a lot of research, the Superfund site, for example, in Calvert City. We do have a lot of other initiatives in West Kentucky, a nursing school and a family medicine residency program in Owensboro, Kentucky. We have had dental clinics in Paducah, Kentucky, and work with dental hygiene programs with the West Kentucky Community College, part of the KCTC system. So we are already in the ecosystem of West Kentucky with regards to healthcare. This would be a growth of that opportunity. It has to be done in the most precise way. It has to be done in the most community engaged way, working with health partners and working with the community and citizenry to make sure we build an equitable and a great program. Also, if we're going to do this in the best way possible, we want to bring our entire mission to that program. We don't want to just make this a teaching program. This should be a teaching program, a clinical program, a community engaged research program. And it should embody all of the things about a healthy work environment, wellness, and great behavioral and mental health for those who are providing the teaching and the care in this environment. So we need to bring our whole mission to that effort, and you can see what a large task that is. I am in the process of working with the leadership at Murray State and our leadership in the School of Medicine to develop more exploratory teams in that regard and to develop some critical goals with regards to planning. And you'll hear more about that in the future.
Perfect. You had mentioned processes and things to that effect. There's two different questions that were submitted that have similar pieces. And it's wondering, could you talk about the possibility or thoughts on building more connectivity if we're getting to the strategic alignment between us and U of L Health of operational effectiveness, processes, expectations, other things to that effect? Do you see a way that we can be much more aligned in how things generate, whether that's seamless transition from one system to the other or shared opportunities with systems or certifications or any of that to help us facilitate as we cross back and forth between
Well,
them?
it's really great. And I think in many levels, the nursing school's done a great job with the nursing scholarship and employment program, and now expanding on that with the House Bill 200 program to increase scholarships for nurses. That's one example of great alignment between HSE schools and the health system. The other way we do this is through our strategic service line boards and the academic health committee. We've expanded the constituents who are going to be on those committees. Those include areas across mission of both clinical care, education, research and innovation, and community engagement. By doing that, in this year, for example, the health system strategic plan included areas across these strategic service lines that were cross-system and cross-medical school concurrent and aligned goals. It's going to be vitally important that we grow that alignment and strengthen that alignment. I think we're operating more and more that way every day. We have to have incredible respect for our partners. We have to be really conscious of their success, and I think they are extraordinarily conscious of our success. So I see increasing engagement with them and increasing opportunities. It's beginning with strategic planning and then the executions of those strategic plans. It may begin to expand into even more areas in terms of how we have shared infrastructure and shared systems in some regards. I think another early example of that, Glenn, and this is a great question, I really appreciate it, is the efforts across AI. So we could have had an opportunity where the health system would have had one person leading an AI initiative, and we would have had another person leading a separate AI initiative with two circles spinning this way. Instead, what we've done, really in collaboration, Dr. Sohel Contractor is really chairing the committees for both of these efforts. We're working with Debbie Mullins, the Chief Information Officer at U of L Healthcare, as well as Carlos Coggers at the university, our Chief Information Officer and Vice President for IT at U of L. So we're increasing the crossovers of the ecosystem between the university and the health system to be able to work collaboratively. I think those are early examples of areas where we're going to see basking.
Perfect. Let's see. So, second question submitted, realizing that resources are not unlimited, are you able to size up what financial resources are available to enable our renewed mission of recruiting funded researchers?
Yeah, there's a couple of ways we have to do that. I mean, we have to always be working on advancement, increasing our number of endowments. I think we still have some buck for brains endowments that we need to fill, and we're actively working on that, particularly, I would say, in the bioinformatics area. The other thing is to look at unspent gift accounts and endowments through the foundation and realize how we can respect donors' wishes, but yet leverage money that's in the foundation and is available for us to put into mission. We have a real opportunity there. Additionally, I think as we understand our revenue through the enhanced Medicaid payment and we see growth in that, we need to think about it strategically in terms of how we distribute those dollars to further enhance our mission. Those are going to be major sources for us to be able to do that growth, but they're predicated upon having a healthy health system. You know, if we are looking at the IGT funds or enhanced Medicaid payments, we do have to have access. We do have to provide clinical care. We do have to really make sure we're deeply vested in the operations of our health system and our health system success. And that includes not only U of L Healthcare, but our pediatric partnership with Norton Healthcare. So my eye is on those parts of our shop that will allow us to produce effective revenue streams to grow our mission.
All right. So another question. I'd love to hear a little more about your vision for the focus on behavioral health in the coming years.
I think we have many. I always say in the most affectionate way that this is our baby. This is our neonate at the table. But it's really an opportunity for us to do great things. U of L Health has Peace Hospital. We have strong elements in psychiatry, pediatric psychiatry, and even across the spectrum in geriatrics with the Traeger Institute and Republic Bank Optical Aging Clinic. We have a real robust number of behavioral health providers. We have the Kent School of Social Work that develops providers capable of delivering behavioral health. We have strong psychology programs in arts and sciences. We need to leverage those in an optimized network to be able to have a delivery mechanism using telehealth and using many other aspects of cutting edge healthcare delivery for mental health. We could truly be a mental health solution for the Commonwealth and state. We have strong components, both from outpatient to intense inpatient areas. We have a strong clinical and translational research program now that's investigating all kinds of novel therapeutics that may help work in areas of addiction medicine. So we need to grow our programs and our ability to be clinical trialists in the behavioral health space. We also need to have a cogent plan, and we need to be able to address the needs of the Commonwealth and to demonstrate to our legislature how we intend to address the needs of the Commonwealth. So dealing with the problems of affective disorders such as depression and anxiety, which riddle not only disparate areas of our community in urban Louisville, but are a huge problem for the rural counties of Kentucky. We need to also be able to look in the space of cognitive disorders such as dementia, Lewy body dementia, and Alzheimer's disease, and expand our abilities and our capabilities in neuroscience that are a crosswalk between those two. So by having pillars in neuroscience and behavioral health, there's an ability for us to crosswalk our research missions between both of those to have even a stronger proposition in behavioral health. So this, although it is our infant, it is really one that has great promise to have massive impact in this area. We have a behavioral health crisis in this country. And this country is depending on academic health centers to, again, to lean into the mission of a university, to both create and disseminate knowledge, but of an academic health system to also deliver optimized healthcare. So if we take those three things together, that's what we ought to be striving to do. We have the pieces. We need to connect the pieces and leverage the pieces in the best way possible.
All right, go back to some of the questions submitted in advance. Could you give an update, at least your awareness status of staff compensation study, kind of some next steps to that have been indicated to you got loyal, you got dedicated, hardworking folks here at School of Medicine. They want to kind of feel the appreciation on any next steps with staff count.
Absolutely, Glenn. And one of the things is because we had not given regular cost of living increases or really rebalanced our compensation portfolio for a number of years, we got behind. So the staff compensation study and the faculty compensation study became very large undertakings. So by doing that, the first goal across both of those was equity by job class or equity by rank if you were a faculty member. And so we've been working very hard to make sure we have pay equity. And I think we've accomplished that largely, although we're still working through the details of that. Secondly, addressing compression across the whole ecosystem of pay. And we're addressing some of those needs. We would love to be able to get to a point where we can take our evaluation system and then also have a merit-based pay increase. We also need to regularly make sure that we're keeping up with COLA and inflationary indices rather than having to pay catch up over a several year period of time of not doing anything. So those are important things. And I think the next major step, especially with the new vice president for human resources being named and now presently on campus, is we have to work integrally as a partner with human resources, not in an antagonistic way, but in a collaborative way to be able to do appropriate restructuring in certain units, to also be able to do great education around our leveling system and our advancement system for staff. And we need to unlock that lock that's been present for a while that allows units to have the flexibility to give increases to people and to reward our employees who've been most loyal and have committed themselves tirelessly to our efforts. So we're going to really work, and we're going to press hard with HR and have a regular presence with them. And I'm glad we have now permanent leadership in that regard, and I think we have an excellent person.
Gotcha. I'll remind folks, we're coming down to the final 10, 12 minutes left. So if you've got any burning questions, just drop them in the Q&A. I got one or two that I can go to, kind of sitting on the submission ones, both centered around, again, alignment with health systems, plural. One of them, could you talk about thoughts on ways to better increase access for medical student shadows who rotate through the health system, because those could be potential residents in the future?
Well, one of the things I would have to give a shout out to Dr. Kelly Bullard Dunn and to Vice Dean Ann Shaw, both Vice Deans, in community engagement and in undergraduate medical education, in their strenuous work with the AHEC system. They are always working to increase our number of AHEC providers. I do think we need to leverage our clinical faculty and gratis faculty. Many of the members of CMG can be operationalized. Many of them are already doing a lot of work with shadowing. Likewise, our pediatric providers in Norton Healthcare. But as we increase our engagements across the state with AHEC, that is a huge opportunity for us. And additionally, if you think about our alumni network, many of them are local. So we talked about a huge alumni network. So also pulling them into the ecosystem, making sure they know about AHEC opportunities, and making sure we grow that community so we can have community engaged experiential learning that's more vast and more diverse in terms of its opportunities, both in every way possible. I'm talking about being able to have rural engagements, small town engagements, areas that are dealing with a lot of mental health issues, areas that are dealing with rural problems in cardiovascular care. We certainly can curate a lot of opportunities. But a shout out to Vice Dean Kelly Bullard Dunn and Dr. Shaw for always being engaged in increasing our network of providers that can help with engaged experiential learning.
So again, this one kind of jumps back into that strategic alignment, but this would be opportunities to really just leverage existing programmatic types of things that are occurring both at U of L Health and Norton, and even on Belknap campus. But hoping to see a thought or an idea of how to better collaborate with the other healthcare partners, and maybe that is through LUMED as a connectivity of saying, hey, if you're offering a service or a program, are there ways to be able to promote that cross-functionally
I think
throughout the
that's a
system?
great idea. You know, the LUMED thing is a powerful instrument. Ostensibly, it is to enhance the and appearance of our 22 block area. But with, for example, the raising or the lowering or demolition of the former correctional facility across the street from me here at Chestnut uh, to the new LUMED Gardens that's coming up over there. LUMED Gardens is going to be a exceptional space. It's going to be an outdoor space that can help with wellness, but it's also going to be a programmable space. We can have events there. We could have a concert. We could do fundraising opportunities there. Even opportunities to raise money for great programs. Programs that are community engaged programs that can help provide resources to those in most need of health equity and other issues. So making this space more inviting and more vibrant for collaboration is going to be good, not only to bring in research partners, industry, all sorts of people, but also our non-for-profit community engagement area, our AHEC providers for educational opportunities, to bring in all parts of our community in a most engaging way. We want this to be an inviting space where people go, wow, I can go there and it's a cool place to be. It's a place where we can solve some problems. It's a place where I can interact with really great engaged people. And the engagement of that space needs to include our partners on Belknap. And many of them really want to be part of what we do. So enhancing the already strong engagements we have with the Speed School of Engineering, the College of Arts and Sciences, the social work, Kent School of Social Work, as I've already discussed, and with the business school. We have a lot of engagements with the business school. So the opportunity to really make this an inviting space, to make this the epicenter of change and advancement and improvement for our community. I want this to be an engine for innovation and improvement in this region.
For the final one, still connected to collaboration between health systems, especially with the role as AVPHA. How do you see opportunities to impact improvement on quality of care scores and other pieces? I know you've talked about metrics and other things to that effect. Any thoughts in that role of how you can help improve influence and things to that effect?
Well, I think there are many. That's a very complex question, and there's a lot of ways to do it. One of the things is to look at best practices. So there are people who are doing things across the country that are absolutely best practices. One of the best practices is developing this LUMED neighborhood and reimagining this whole neighborhood and this whole space in all of our spaces to really be mission centric and to help enhance our mission. So I think that's one way that we do those sorts of things. I think that also, improving the metrics for the sake of the metric is not why we do it. We want to be recognized for the good work we do. So we have to look at those metrics and we have to really make sure we're leaning into our mission. Those four pillars are really strong things. So we don't want them to be dry. We want them to be lively. We want them to be alive, and we want them to be part of our regular vocabulary. We want them to be part of the fiber of what we are. So I like people to carry those around. I'd like it for every one of our learners, our staff, and faculty to almost have an elevator speech about what we are and what we do. If somebody asks them on the street, what's going on down there at the health science campus? I think every one of us should endeavor to have about a 2-minute speech that comes right off the tip of our tongue that is so excited and lets people know how much we really care about the community, how much this community means to us, and how much we want to leverage ourselves to be the best we possibly can be.
All right, we got one that just came in. This will probably mark maybe our last question as well, as we're coming up to the end of the hour. You had mentioned on expanding your thoughts on compensation study for staff, but overall the need to develop bridges with HR and develop opportunities to enhance promotion opportunities. So this was promoting and developing staff through the ranks has been a stated goal for many of us. So how can we work to combat loss of talent by enhancing promoting opportunities from within?
Well, I think a lot for compensation's a part of that, obviously. I think the equity was part of it, but people need to see the opportunity for growth. So the laddering system, we have to know about it better. We have to understand it. And that means not only the employees and the staff themselves, but also the supervisor community. That has to be transparent. We have to know about it. And then we have to build intention around it. So, if you have an evaluation and you're meeting the metrics and you're exceeding the metrics, then you ought to have that growth opportunities. We ought to continue to look for that. We need to keep compensation competitive. We can't let it lag behind. We can't let it fall behind. That promotes insecurity. And then I think the other thing, Glenn, the work around smart staff and staff support mechanisms, having a voice, having an audience, having a way to communicate with leadership are vital things. You have to be heard. And I will endeavor to make sure you're heard and make sure I'm listening. And I'll create intentional points where I can do that. And Glenn will hold me accountable for that. And then the wellness piece. Let's not forget about that. And I mean wellness in the broadest sense. I mean, having adequate time for self-care, having adequate time to attend to your family and attend to your own personal needs, making sure that we have adequate healthcare availability and opportunities, mental health care availability and opportunities, and then ability to just have healthy places to eat, healthy places to exercise, a nice and healthy place to walk and go outside and enjoy during your lunch hour. Those are going to be things that we have to do. We know we've had a relative paucity of food options down here. This collaboration hub building, that's one thing that it has to address. And it probably has to address that on its primary or first floor level. We have to be able to be accessible and provide healthier, better, and thoughtful opportunities. A nice place to go have a cup of coffee with a colleague. A nice place to sit down with a colleague in Lumet Gardens and have a conversation. We can't develop these things overnight, but we are well in our way to really transforming this campus into a place where it's going to be a really engaging, exciting, vibrant, more comfortable, more enhancing place to work in for live.
I think that'll close us out. I'll give you a minute if you want to any final last words or thoughts. And other than that,
finality, and I said it at the end of my talk, Glenn, but the best thing that I could say at this point, and I mean it so sincerely, is thank you. Things that you do every day are not easy. I've been here for 30 years, and I understand that. Taking care of patients, making sure experiments are done, making sure your mouse colony is healthy and not contaminated, making sure that your lectures are meaningful, making sure as a student that you're ready for step one in clinical rotations. It's all difficult. It's hard work. But if we do this work together, we care about each other, and we work hard to be partners with each other, then we will elevate this whole operation to heights that it's never seen before. And we can really soar. So I just leave you with that. Thank you so much. Continue to care about each other and continue to care for yourself.
As a reminder, we recorded this. We will get this posted out soon on our School Medicine YouTube page. It'll also be in the September newsletter, the link to it. So if you want to be able to look back on this and rewatch it and share it with anyone, you'll be able to do that. With that, I think we will go ahead and close out today's event, and thank you for attending.